Well, Dimitri, thank you so much for joining me here today on The Ripple Effect with Ray. We've got Dimitri here today, founder of MyoFit Therapy Fargo. So excited that you're able to join us here today.
Thanks for having me.
Absolutely. So tell me a little bit more about MyoFit. How did the idea come about and what is it?
So I'll try to make it as quick as possible. I was in the military, then I got out and I was a cop for a while. Injuries caught up from when I was in the military, and I just felt like there needed to be a change because I didn't want to be a liability to the rest of the crew and everything. So I went back to school, and exercise science just was a kind of a general thing. I was like, I know how to exercise. Sure, why not? Let's give that a shot. But originally, I was going to PA school. That was the goal, at least. And then along the way, I just realized I need to be outside. All my jobs were very much either manual labor and outside type stuff. Even as a cop, you're outside, everything's changing. I didn't want to be in a clinic. So right off the bat, PA went away, PT went away. Then I thought about cardiac rehab. Then I realized that's also not quite what I thought it was. So one day my wife was like, "Hey, you want to talk to somebody about athletic training?" I was like, I don't want to teach people how to work out. Doesn't really sound like me. And she's like, "That's not what it is. You should probably ask somebody." So I asked the school director at the time for the program, and she was like, "That's what I do." And I was like, "What do you mean?" She's like, "I'm an athletic trainer. I can tell you everything." And I was like, "Okay, cool." And then I got a quick rundown of what it was, and I was like, that sounds like me. And at that time, we had just transitioned to a master's mandatory. So I jumped into the program here at NDSU, and then yeah, so while I was in school, I just started realizing that ATs are very much like PAs. We have a lot of autonomy, and we don't always have like a physician to refer back to or anything at that time when you're working. It's usually like a referral basis or something like that. So I was like, yeah, this is awesome. And if a PA can open a clinic, why can't I? So I just about a year, 2 years into my career, I was like, I'm going to reach out to somebody that knows more than me. And I found Sarah Richardson, my mentor, and she basically gave me the lowdown on how to get started and everything. And so I basically was like, well, it's a lot easier if I just take her branding and run with it. So we made a licensing agreement, and here I am. So yeah.
That's an amazing story, and I completely understand wanting to be outside, not sitting. And yeah, I think that's so wonderful. So I think you had told me you work primarily with the young adults, right?
So yeah, I started with collegiate athletes out of college. And then due to the distance that I was traveling about an hour a day or 2 hours a day, hour each way. And my family, I have a young family still, even though my oldest is about to turn 21. I still got a 6 and a 7-year-old. So I needed to spend more time at home, and those long travel, it's not conducive to an emergency either, because if something happens, I couldn't be around quick enough. So I decided to go take a job at a high school here and in the morning open my clinic. So that's how that kind of worked out. And so now I kind of work the gambit. I have some club teams like rugby. Red River Rugby is one that I work with. I've worked with a couple gymnasts, some cheer squads. They're more of the pediatric population. And then, of course, at the high school, it's all pretty much that high school, some middle school as well, because I also am responsible for the middle school. So, yeah, I got a little bit of everything now, but mostly kids. Yeah.
Yeah, which is great. And I'm sure, yeah, middle school, high school, fair share of injuries as well. So I'm sure you see quite a lot. What are some industry trends that you've been personally seeing with the work you're doing?
A lot more chronic orthopedic injuries that typically weren't seen until like college or at least adult level. So now that we have year-round volleyball, year-round basketball, year-round soccer, these kids are having a lot more of these chronic long-term issues, such as like there's kids now that are blowing ACLs at a much higher rate than they used to be. There's also the cartilage wear. We're getting a lot more chronic meniscal issues, not just like the spontaneous like hey, I cut, now my knee kind of clicks and pops. We're getting a lot more of this, like, I don't know, my knee's been kind of hurting for like 6 months. It's just getting worse. And now it's kind of clicking and popping. And it's like, well, it's because you're doing too much. Some of our athletes even do two sports while doing a year round sport. So that's not the best scenario if you're not trying to, burn out or get injured. And I'm also seeing a lot more kids that are great high school athletes no longer want to play their sport in their junior, senior year, or even at college because they just are tired. They're just so burnt out from it. And some of them even accept stuff to go to college, and then they get there and they change their mind and don't want to play the sport anymore either. So they're just getting burnt out a lot younger.
Yeah, it sounds like it, and what would your professional recommendation be to kind of help prevent that from happening? You think it would be to go back to not year-round sports, or what do you think could help these kids?
I think it's just the specialization of one sport for year round is the problem because we have kids that don't seem to have a lot of these issues. They're still onesies and twosies, obviously, but for the most part, specialization before high school and even before like junior year is detrimental, I guess, in the body as far as like now you're honing certain muscles, but you're lacking in others that also need to be refined and built and grow for you to be a productive adult athlete. So when you get somebody that plays football, then plays basketball, and then does track in the spring, it seems like it's a perfect combination. I see a lot of those athletes thriving and flourishing because they've strengthened their legs and their arms and everything in a totally different way. They're getting their cardio, they're doing all the things. Now you can still get injured. There's a risk to playing sports in general. So no matter what, there's always going to be a risk. But starting that specialization before high school is almost unnecessary as far as if you're trying to, become the all-around athlete that most people want to be. Now, if you there's a study out there now that says that you can even start kids as young as 6 years old with resistance programs. And resistance programs are great. It's just people hear resistance and they're thinking, oh, I'm going to give my kid creatine and have him lifting weights. And that's not exactly what that means. It could be as simple as bands and doing push ups and sit ups. Those little things seem to help your kid, even at 6 years old, to have better proprioception, have better understanding of exercise, build that, tolerance to what can be perceived as like an injury, which is not always an injury. Sometimes you just have pain. There's pain with exercise, and knowing those differences at a younger age makes it so much easier as you get older because you know what you can push through and what you can't because you felt that resistance, that training before. So by the time they get to high school, they have a much better understanding of their body and what to expect.
Absolutely. Yeah. Starting getting those muscles moving, understanding what it takes to actually, use some of those muscles, get to know the body a little bit more. What would you say has been one of your greatest, challenges within your business? What's been working really well?
On the business aspect, it's just a small community. Word of mouth is gold. It's way more than any marketing that you could do, way more than any social media or anything. And especially with athletes, trust is built with athletes. And I think that athletic trainers know that probably more than most, that trust between you and the athlete matters immensely because when you're telling them they're fine when they don't feel fine and you're pushing them when they don't feel like being pushed, they need to know that you have their best interests. So that trust is necessary. And then when I'm dealing with adults, it's no different than with a kid. You want to know that you're getting your bang for your buck, no matter what it is. It could be buying a car, and it could be just getting some stim on a muscle just to make it feel better. But you want to know that, the person that you're dealing with has dealt with people that and they trust you. So yeah, that word of mouth is definitely building that reputation can be tough, even with your friends. It sounds like, it would be an easy thing. Oh yeah, just stop by, I'll take care of you. And sometimes it can be, but I would say the majority of the people that say that they would take your help need to be convinced on spending the money to get that help. So
No, that makes complete sense. And I mean, word of mouth is great and all, especially when you have the referral base, but it can also be unpredictable. So,
yeah, it definitely
um,
can.
so completely understand that. And what would you say has been something that you are just really grateful for, that you decided to pursue this path in particular?
I mean, I'm very thankful to Lord just because like honestly like I've been through the ups and downs of life quite a bit. Military was actually my main goal in life, and that was where I planned to retire, and that was just my thing. So since I was I don't know, probably 3 or 4, I was playing like I was in the military, or the army or whatever. And so it was kind of devastating not to have that. So you go through like this, just like athletes do. You go through this understanding that you're not what you do for a living or you do for a hobby or you do for whatever you can push through things and you can move on and what you did doesn't mean that you're less now that you don't do that thing. It's just a transition in life, and so I found a path that was kind of already set up for me. I just had to sit back and just kind of trust the process, and I would have never thought I'd even make it this far, to be honest with you. I just figured I was gonna be an athletic trainer and work with the military, and that was just going to be it. And then that just life takes you in a weird direction, but you'll make it somewhere. You just might not know how you got there exactly, or what's planned ahead. So yeah, I'm just thankful that I made it this far, and then we'll see how it goes.
Absolutely. No, I completely can understand what you're talking about. I we think life is going to go a certain way, right? Like how to make God laugh is tell him about your plans, right?
Yeah.
And so we always kind of have this idea, and then a lot of times when things don't go our way or not as we expected, sometimes it turns out a lot better, sometimes not so much, but we can always sit back and relax or sit back and reflect on what that opportunity had showed us or how we grew from it either way. So I completely can understand where you're coming from. And where would you say you hope to be in the next 6, 12 months from now?
6 months, I hope to be a little more established, getting a lot more client base into my program. I also want to start doing more rodeo. I've been doing rodeo. I love rodeo, but I want to be able to do it more, even if it requires travel. I'd like to focus on expanding into sports that I don't get to see every day. Combat sports as well. I train, and I'd like to help those that also train in those sports. And I think it's at the 12-month mark, I would like to start thinking about transitioning maybe into just my business full time and focusing more on that side of things. But it's tough because you make all these connections with these athletes at the high school. So I don't know. It'll be tough in about a year to say where I want to be. But again, I'm just on the ride. So it's
Just
wait.
along for the ride, exactly. Just
Yeah.
trying to see how things unfold in their own natural way.
Yes.
I completely get that. And so, for those people listening, how and where can people find you? And if you'd like to share.
Oh yeah. So we actually, me, Sarah, and then there's 2 others that have MyoFits across the country. So yeah, just go to myofittherapy.com and you'll find us there. And if you have any questions, you could just reach out to any one of us. We're always willing to help and share information as well. So yeah, it's pretty simple. And if you're here in Fargo, 2800 University Drive South, and I'm here in the Fargo Spine Clinic chiropractic office. So yeah.
Amazing. So, you're in Fargo. Where else are you?
We have Indianapolis. That's my mentor's place. She's got a couple there. Bill is in Illinois, and there's one more down in Georgia. So,
Okay, great. Well, I'll keep that all in the show notes. And anything else that you would like to share about whether it be athletic training, about youth sports, anything that you want our listeners to really walk away with?
just to remember that kids are changing. So, as parents, sometimes we're like, well, I never had to do that. Kids are evolving differently. The bone type, body structure, the need for bigger, faster, stronger is starting to wear down on the bodies of these young athletes. So sometimes just take a step back and just trust it. Trust the athletic trainers, PTs, chiropractors, doctors, everybody. Just trust they know what they're doing. It's not to stop anybody from playing. It's just to make sure they have the longevity of it.
Absolutely. Well, thank you again for joining me here today on The Ripple Effect with Ray. It was such a pleasure having you here, Dimitri. And if you liked today's episode, feel free to hit the subscribe link and take a look.
Yeah,
Thank
thank
you.
you.